We don't want pre-audit panic. Is we want to be at a point where an auditor can walk in any moment and feel confident that we're on top of it. The auditor needs to walk away from your service feeling confident that you know what your systems are.
Hi everyone, I'm delighted to welcome Sherri Makepeace to our conversation today, where we'll talk about provider registration, the NDIS legislation changes and what these changes mean for providers and all the good interesting things. So I'm lucky to talk with Sherri today. She basically has been in human services industry for over 20 years and has held roles in New South Wales and Victoria governments as well. And she has worked on large community projects relating to homelessness and also organizations such as WIRE, which advocates for women's equity and provides resources and support to women, which is fantastic. So now Sherri is a founder and owner of Makepeace Co, and she helps providers with compliance and registration process. And on top of that, she's also an approved NDIS Quality and Safeguards Commission auditor. So that's why she is here, and it's been delightful that she agreed to come in and talk to me as well. So welcome, Sherri.
Thank you. Thanks for having me on.
Thank you so much. Well, you have so much experience in this industry, and I guess it would be very interesting to hear what got you into this sector to begin with, and how did you transition into the policy compliance and then building your own business?
It's a pretty long journey, as you can tell, 20 years, quite long. But look, I just always been very passionate about helping disadvantaged community. And that's what I kind of sort of like say with everything that I do now. It may seem like I'm directly supporting providers or service providers, but my end goal is the same as everyone else's end goal, and it's about helping people who are disadvantaged to make sure that they're receiving safe and effective services. So regardless of what I'm doing, I guess that's sort of where it's at. Yeah, I did start very much in a small little town called Deniliquin, back of New South Wales, working as an admin person in a women's violence service, and over the years, worked at the Department of Housing and a whole range of other organisations. So I was able to really sort of, I guess I was project manager, so I was able to go in and do projects and, learn a lot about different industries and move on to the next project, and also doing a bit of teaching at TAFE as well. So I think, when I got to the point of starting my own business, I was actually supporting providers to transition from the previous block funded models through to the new NDIS kind of model. And that was my role in state government. So it was just sort of like it was a very natural progression, I guess. I decided to be an auditor, but then, that can get a lot. So having the consultancy stuff on the side, being able to support organisations across Australia with their compliance is sort of what I do now. I was a much bigger organisation for a little while, but it's just me now. So I'm very selective kind of around who I work with, and I have very niche clients that I just support on a monthly basis to maintain their compliance, and just making sure that, and we also do a lot of training as well. So capacity building, I'm very much about sort of building the capacity of people to understand and be able to operate and run their own systems and feel confident in that, and to a point where if you're going into audit, and we don't want pre-audit panic. That's what we want to, that's the aim of the game, is we want to be at a point where an auditor can walk in any moment and be happy for them to look at our systems and feel confident that we're on top of it. So it's about building systems that support people to really, it's like clockwork. It's not like a concerted effort or panic. Audit and compliance, it's just a process that is inbuilt into the organisation. I hope I answered your question.
Fantastic. So you basically come into the provider's business, whether it's online or in person, and then kind of just go into their documents and check that everything is compliant. Is that what the process looks like?
Well, different people come to me for different reasons. So, some people come to me at the initial point of their policies being developed. Some people have already been through a couple of policy companies, and they've the process has not been effective for them. So they've come to me and asked, look, can you help me? Because when I create policies and procedures, I co-collaborate with my clients. So you don't get to come to me and say, can I have policies and procedures? Because that's not how I operate. What I do is I actually put people through a 6 to 8 week program where I deliver, I call them stations, probably a silly name, but they're just stations. So each week there's like a set number of policies with the associated forms and the tools and things, and we go through those together. I obviously create them, we go through them together. The provider can say to me, look, that's not how we do things here, we do it like this, and I'll say, well, we have to change it because it's not compliant. Or I'll say, no worries, let's change this policy and make it work around you. So it's a real partnership, which is why I'm probably very, there needs to be a commitment to me and a commitment to the organisation to be able to make sure that we get to the end of that 6-week process. They're ready to go to audit. But for other clients that come to me, I essentially meet with them on a monthly basis. Some people have me come in quarterly and do little action plans, but a lot of my clients that I see every month or every bi-monthly, depending on the size of the service, I chair what I call an internal quality and safeguard meeting. And what that means is that we look at all the higher level kind of things in the organisation and monitoring and tracking and making sure that they're all going the way that they should. When was the last time the strategic plan was reviewed? Because we know we have to keep on top of that. It's not something that's forgotten. When was your emergency plan last reviewed? When was your, did you test your emergency plan? Have you done your annual survey? Are there any new organisational risks? Have you done this month's internal quality audit? And what was the outcome of that? And how can we link that to continuous improvement? Let's have a look at your complaints register. I can see some trends or themes in here. And how can we create, system changes that will prevent that from happening again or recurring? Same with incidents. We look at any compliance or legislative changes and look at what that means for the organisation, and then it might mean a policy review or a form review or whatever. So it's just like that. Usually those meetings go for about 2 or 3 hours. They can be quite lengthy, and I think sometimes my clients want to kill me. Because they're not that pleasurable. But if you can set aside that time every month to have that process in place, it does mean that everything is tracking as it should be in the governance space. And we also do training. Sorry, I'll just mention we do training as well. So I do run a governance masterclass for organisations that want to understand governance. A lot of providers kind of get into this space with really, really beautiful, clear passion and visions for supporting people with disability, and that's where they're heart-led. But unfortunately, well, not unfortunately, it's actually fortunately, NDIS requires us to have a higher level kind of skills around governance as well. So sometimes providers can sort of trip up on that space and they want to learn more. So I do run governance masterclasses, and we're also partnered with Allen's, where we can deliver nationally accredited training for first aid. I don't do it myself, I'm not clinical, but first aid, medication, seizure management, all those sorts of things as well. So they're also available to providers that work with us, or anyone really, yeah.
Oh, wow. So you have raised quite a lot of points there. There was one that struck out to me as very important. You mentioned that, setting aside that monthly time with the consultants such as yourself, just to go over all of the processes, make sure everything is aligned in your business. That kind of actually saves up so much time down the line when you have to go through the external audits, because those are they require so much time and energy, and no one likes them.
No one does. They look at me, especially when the managers brought some staff into the meeting, you can just see them looking at me, zoning out, just going, oh, which is probably not a very good sales point, but it just has to be done. It has to be done. It doesn't matter how great the support workers are on the ground, this other stuff needs to get done.
Absolutely. And I can attest to that. It is a lot of work, and it is very boring, and it is hard. But having someone there, such as yourself, I think it's just that one extra person that you're accountable to in that moment. And I guess it kind of makes things a little bit easier, just because it could be a little bit more casual, more relaxed, rather than an external auditor. And that way, that is a chance for you to just go over it with a consultant and make sure everything is okay. And it brings me to another thing you mentioned. You don't do just templates, right? Because there's quite a lot of companies out there. Actually, that's something I wanted to talk to you later on in our conversation, but that's okay. There's quite a lot of organizations out there that try to push the template approach, where a provider can come in, purchase a package, let's say for core supports, and then off they go. And I find that a lot of those people then don't actually know what's in their policies. They don't know what the procedures are about, and they're not implementing anything. What are your thoughts on this?
Yes, well, I obviously, it's not something that sits well with me whatsoever. Like, as I mentioned when we first came in, I put my clients through a 6-week program to develop their knowledge and understanding, because you can buy the packages, and there's often, I always find it quite interesting. Actually, some people will contact me and they say to me, do you 100% guarantee I'm going to pass my audit? Like, well, no, because I don't know what's going to come out of your mouth when the auditor asks you a question. I can't guarantee that you're going to pass your audit, or they're not going to talk to a client, and the client's going to say something that, like, nobody can guarantee you 100% pass your audit. So let me just put that out there first up. But Lisa, you're absolutely right. You can, have as many templates as you want. And I might add there too, quite often there's like lots of documents. And so the organization feels they're getting great value for money because they've got all this big package of documents. But what happens is, what I see a little bit is like, there's so many, they could be just merged into one policy. They don't have a supervision policy and procedure, performance appraisal policy and procedure. Have a human resources policy that captures everything in one. The less policies you have, the more likely you are to be able to A, find it when you need it, B, like manage it better in terms of like review processes and things like that as well. But the other side of what you're absolutely saying is that just because you've got it in your hands, it doesn't mean that you understand it. Now, you know that the audit process is a two-stage process for a certification. So what that means is that you need to be able to A, present the documents, which the documents are usually written, if I'm being fair and honest, they are being written to the standards. So generally they will pass stage 1. The problem is a stage 2, that is about asking you questions. And the auditor needs to walk away from your service feeling confident you know what your systems are and that you're committed to implementing, and that you have the skills and knowledge to be able to do that in a way that's going to keep the participants that are accessing your service safe. So if you're not able to do that, there's just no way you can do that. Like, I think even if you sat there and read every policy from front to back, it's still not going to teach you how to do it in a practical sense.
Yeah, that makes sense. Let's go into the process of registration, because you're obviously already kind of describing some of those process. What is NDIA registration, and how does one check if they are registered, and what do you do to become registered?
I mean, look, if you're registered, you will know that you're registered. You cannot be registered without being audited.
Sorry, I meant for, let's say, for a participant to know that a provider is registered.
Yes, okay, I see. Okay, that's okay, very clear now. The company themselves are like, oh, they should know. Yeah, look, essentially the service should be listed, or they don't always have to be, but most services will get listed on the NDIS website. So you're able to get on there and just search providers on there. So you're able to tell that they're registered.
For the participants, what does it mean when a provider is NDIA registered?
I talk to lots and lots of people around the traps. I talk to people who use services, and what I hear most of all is that, I guess, that surety of a registered provider is that they've got insurances in place. You know that they've got adequately skilled and qualified people, or it's being tested through an audit process. Everybody's got NDIS worker screenings, because you obviously need to have that to become registered. And I think, I'm aware, I guess, I do see a lot of the forums and things, and I know that there will be people out there right now that be going, well, just because they get audited doesn't mean. Look, it's just a higher chance that if a person's registered, that they're more likely to be doing, have all the appropriate screenings and trainings and things like that in place, so that, I personally would feel a lot safer myself using a registered service than an unregistered service.
Yeah, that's right, because there's so much more compliance that the provider has to go through in order to become registered. So you're kind of making sure that the person that is supporting you has gone through that rigorous testing and has the policies and procedures in place and know what they're doing. There might be some, we can talk about if some areas where registration doesn't cover, but still in majority cases, if that is the case, it's almost certainly better to choose a registered provider. But in terms of the whole ecosystem of providers, I've recently was looking into the figures, and there's only about 1,000 or even just less short of 2,000 providers that are registered compared to like thousands of providers that are not. So I guess my question comes from, people know that auditing is a hard process, it is difficult, it is time consuming, and at this stage there are not really any mandates for certain providers. There are some mandates for some categories of supports, but not for all. I guess, what is the incentive for the provider to get registered right now?
Yeah, if I can just drop into your first point, and that was just around, auditing being a challenging sort of process. Look, my experience is that I feel like if you're an organization and you're doing the right thing, or you're trying to do the right thing, or you understand what the right thing is and you're working towards it really hard, I think you'll find that auditors in general will be quite understanding and supportive to try to kind of like work with you around, you might get nonconformities, but it's not the end of the world. It's about going, okay, we need to fix it straight away. So, I hear a lot about auditing processes, but look, a lot of people are very positive about it. And, I think that I encourage my services that I consult with to, welcome the audit process, to be able to identify any gaps, to be able to always improve. So the incentive to be, look, well, I guess at the end of the day, if you want to support agency managed clients, you need to be able to be registered, otherwise you can't claim the funding for it. There's also the fact, I guess, that you have to be a registered provider under 2A to be able to support participants with behaviour support plans with restrictive practice. Because if you're not registered, you're starting to limit your market. If that's, you're wanting to grow a business, you're really limiting yourself. Aside from that, I do believe it sets a culture within the organisation of professionalism. And if you're registered, you've probably got policies and procedures and things in place. And I always say to my providers that, there's NDIS compliance, and that's important. But having policies and procedures in place will support you if you ever have a WorkSafe claim, if you ever have a Fair Work claim, if you ever have an investigation of any type around any sorts of allegations of anything, because you will know that you'll have the right systems in place to back you and support you. And as a business owner, it's just a huge risk management tool to have all the systems in place. Yeah.
Okay. All right. And I guess, do you foresee any changes in this field, in this industry, in terms of mandated registration? Because it feels like, there's already been one for support coordination. So they're going to start piloting this, I think starting this month already, they said. They will start doing the registration for support coordination. Am I understanding this correct? Would you know what I'm talking about?
I do know what you're talking about. I don't believe that it started yet. It's still in discussion, is my understanding of it. I did actually just see something that came out from NDIS, I think it was only yesterday or the day before, which was saying basically that it's still in discussion. It did not start on 1st of July. And I guess you're asking me for my personal opinion as a consultant. I do, and it's just for the purpose of safety of participants. Mm-hmm. I think it would be a rather wise move to ensure that support providers, NDIS providers are having, over the years, what I think providers forget is that what you're actually doing is you're actually working for the government. And there's been no government service in the history of Australia that hasn't had to meet certain standards to be able to access that funding. It's how it works. And I think we've just seen this massive change of people from private or commercial, going, oh yeah. And I think sometimes there's this it is the participants' money and it's their choice and their control over that. But that money is coming from the Australian Commonwealth government via a participant to you. And so I believe there should be some requirements around the standards of what providers should have to meet to ensure that they're delivering safe services to participants.
That's a really good point there. I recently have been in online, so I am part of a few online NDIS groups in Facebook. And recently I have seen someone post anonymously as a support coordinator, a photocopy of a participant plan, a screenshot with the description that they were asking about. Can you please help me interpret it? And it has been absolutely crazy to have a look at this screenshot, and right away you can see a participant's NDIS number and name, and everyone in the comments was just absolutely horrified that this person clearly does not have the right training operating in it. Because the point that you're raising is that if you're going to claim for government funding through providing work to the participant, then you should have those regulations in place. And that was horrible to witness, to be honest, because that person could have had that information taken in seconds, and someone could have put a bill through under their funding. And so, yeah, that definitely was something that horrified a lot of people in the industry. And I guess you're right in saying that if you're going into this business, then you definitely need to have those things in place, have the right training, and have the right policies, and all of those accountability to the government.
And there's so much more with data breaches. It's the OAIC that where information where it could cause harm to a person needs to be reported as data breach. But yeah, I stay off those forums for that reason.
Sometimes there are definite positive comments where you can see that people know what they're doing and they are genuinely providing reasonable advice, but at the same time, I understand what you mean. There's a lot of fighting in those forums, and I genuinely try not to. A lot of misinformation as well. So I definitely don't encourage people to rely on those types of channels to get the information. Definitely not. Yeah, but in any case, let's move on to the registration process. I guess, where would the providers start when they want to register? Where would they start?
Usually when people contact me to get support for registration, I think, one of the things is you probably need to speak to an accountant to determine whether you want to be a company or a sole trader, with clear projections and planning around how much income you're going to make. I think there's been some process changes actually recently. I'm not 100% sure, so I don't really want to comment on it. But I have in the past seen clients that have come to me and said, oh, look, I'm just going to stay small. I'm just going to do this little business. I'm just keep it niche. I've heard this all before. And then what happens is they start their service and I say, look, because once you reach a certain tax bracket, and this is not my area of expertise, so I'm not going to go into detail, but you do have to, you go into a higher tax bracket with the more income that you have. And sometimes the company structure will save you with that stuff. But yeah, so what happens is they come in as a sole trader saying that they want to stay small, blah, and then they come back to me 2 years later and say, oh, actually I have to go to a company. So if you go to a company, you actually have to go through the registration process from start again. You don't just get to send an email to NDIS saying, oh, okay, we're a company now. That's not how it works. You are now a new entity and you now need to go through that entire audit process again. So the first thing is really do your research, and it depends what you're providing, but there's a lot of information. I think reading the NDIS quarterly reports, they can provide you with some really good information about the growth in the region of which you're intending to actually provide services. If you're doing SDA, you can actually do SDA demand mapping to find out exactly how many participants in your region that need SDA at the moment for which category. So doing your research, understanding your business structure, and then I think the next step is to really think about obtaining policies and procedures and training and understanding. It's so hard when you've operated as an unregistered provider and then you try to start implementing new systems. You have to go back and change all of your client forms. You have to change the culture of the organization to understand, actually, no, now when there's an incident, you have to report it on here. It's just it's very difficult. So I recommend that you would, before you even start, you would say, okay, I want to get my systems in place and understand my systems before I start recruiting into the business. Then you're going to have a fairly big job, really, of trying to figure out who your consultant's going to be. There's a few things I don't need to say, but I want to say, and I say to all of my clients, I say, go get other quotes, because that's fine with me, but I really want you to check to make sure that check the qualifications of the person that's going to be writing your policies and procedures. I guess consultancy is unregulated. So you could wake up tomorrow and plagiarize anyone's policies and procedures and call yourself an NDIS consultant. So keeping that in the back of your mind. How much time are they going to spend with you around explaining things that they're developing for your business? Are they going to co-create with you and help the implementation process along the way? So they're the things that you really want to consider. It might cost extra because time costs money, right? To have somebody to teach you, because anyone can get there, as we said earlier, there's many ways to get policies and procedures, but it's about that person that's going to support you on your journey, develop your growth and build your capacity as a business owner, as opposed to just buying the policies. So they're the things you kind of want to look for. That's what you want to get. You want to get your knowledge, you want to get your systems in place. The next thing that you're going to need before you go to audit is you're going to need to have insurance in place, which maybe you've already got that, because if you're already seeing participants, I would hope that would already be in place. But you will need public liability, professional indemnity, and if you've got anybody working for you, you will need workers' compensation. There's also some really mandatory things that you need to be making sure that, so you'll have staff files. So you'll need to make sure you've got your NDIS worker screening. If you're working with children, you'll need your working with children check for that state. You'll also need to have infection control training. You'll need to have your NDIS worker orientation module. There's probably a few more, but you need to make sure, and your consultant should guide you through that and support you around what you need to have in place ready for audit. Once you've got your systems in place, and if you've got clients, all of your files should hopefully be up to date, whether that's staff files or it's client files. They should all be up to date. You should be feeling pretty good about your knowledge. And then you need to find an auditing company. So on the NDIS website, you can actually do a bit of a search on all the different providers. I'm just going to take a step back a little bit, because you need to enter a self-assessment onto the NDIS portal as well as part of before you do this. When you do that, you have to answer a whole range of questions, and it's about your systems. How do you do this? How do you do that? You need to fill all that out. And what does that generate? A scope of audit. The scope of audit is what you need to give to the auditing companies for them to be able to quote you. So when you put your application into the portal, you need to pick which registration groups that you want. I guess that's the other side of the consultant that you get. You need to get someone who's going to take you through and explain to you what all those different registration groups are. Because I've seen people go through the audit process and then go, well, I need this. And it's it's too late. You've just paid for your audit, you paid for your policies, and now you can't support those people because you don't have that registration. So getting that really clear about that is really important before you put your application in, and you might need the guidance of a consultant to do that, to explain it. You can send your scope of audit out to all of the companies to obtain a quote. I'm going to just say again that do your research around it's not always, I feel like that cheapest is not always best. It is sometimes about looking at the company, what their experience is in the human services sector, who they're engaging as their auditors in terms of their experience and knowledge. And you do need to shop around as well around that. The other thing is, it's really important, and it can be very difficult for providers in those early days, but where are you taking your business? And this is what you kind of want to be clear about as well, because if you are thinking that potentially you want to do another standard, like you might want to provide another service later down the track, it might mean that you need to meet different standards, like the mental health standards or whatever. So if you can find a company that also audits that, it's going to save you money, right? Because you've got the auditors coming out, they can do 2 standards at once, and they've got the skills and experience within that company to be able to do it. So again, as I said, cheaper is not always best. It's about really thinking about what you need for your service and the experience you want to have as well. So once you've done that, you accept a quote and you say, yep, I want you to audit me. What will then happen is they will go through a process of, every different company is different. They've got different ways of accessing your documentation, but they will talk to you and plan and move into a stage 1 audit. So you've got the stage 1 audit, which is predominantly just looking at your documents, making sure you've got everything, you're prepared for stage 2, and that, everything's aligning the way that it should be for you to move into stage 2 of your audit. And then stage 2 is testing all of those documents that you've given to them in stage 1. Now, the thing is that once you've been through that process, you may get a nonconformity or two. It's nothing to worry about. It happens. But usually you'll find that an auditor will be quite clear about what that nonconformity is and why that exists. So that gives you an understanding to be able to move forward from that point. If it's a minor nonconformity, it won't stop your registration going through. If it's a major nonconformity, it will hold you, you need to fix it before they can put you through as a recommendation for registration. So there can be a bit of a hold in that. There are some other ratings and other things. If there's lots and lots of major nonconformities, it may result in a non-recommendation for registration. That can happen. So yeah, and then it's really just a waiting game, waiting for your registration to come through. I have seen some providers, I'm not exaggerating, wait for up to 2 years for that registration to come through. It can be a bit of a shock for people when they think, they're all excited about starting their NDIS service. And then when I say, well, we'll do all this, but it could be 2 years, that can be a bit of a shock to providers. So it's something to consider as well if you're thinking of starting an NDIS service and you're counting on that registration. If you're doing SDA, for example, you can't do that unless you're registered, or 2A unless you're registered. So yeah, you need to be really clear about understanding that it could be a wait. I have seen some people come through in a few weeks, actually. It can be, but it's better to prepare for the longer haul. Yeah.
Yeah, all right. Well, you explained it very well. Thank you. So a couple of things that I wanted to point out to everyone is that you mentioned discussing this with your accountant. That's what you began it with, because a lot of people go into the NDIS space thinking that you can start off straight away, get some, clients, start making profit, things like that. But actually it is very important, as you mentioned, Sherri, to look at the quarterly reports. I just recently looked at the support worker profit margin, and that was about 2% that was reported. So there's a lot of comments online as well about it, saying how is this possible? I'm struggling, and I think a lot of people do struggle with it just because they didn't really think about these types of aspects. Yeah, but also obviously the increases in daily costs and operations, things like that. But I think you raised a very valid point, something that people definitely should look into, depending on what kind of business model, which kind of supports they're going to provide to the participant. And then the other thing you also mentioned, if someone misses out a category that they want to register for it. So just can you please kind of explain it a little bit further? So basically what you're saying is, if someone forgets a registration group, then you won't be able to provide those supports under this group if you already passed the audit. And does that mean you have to redo the audit in order to gain access to supports under that category?
Yeah, so just to be really clear about that, nothing's ever absolutely, a straight line. So if you've been registered for the core module, which includes most of those sort of more service delivery registration groups, and you miss a type of registration group, what can happen is that, you can't claim for that person if they're agency managed, because you haven't got that registration group, so you can't claim against it, right, within the portal. So depends which registration group it is. So I just want to be really clear, if anyone is listening and they're thinking, just check, because there's just different rules for different things. It gets a bit kind of messy, but you can do a variation to scope of audit. And if it's a registration group within the core module that you haven't got, you can actually request a variation to scope. But if it's a specialist module, you'll probably have to have an auditor come out again just to audit that specific module. So yeah, it is kind of messy. Yeah, but essentially, if you're not registered against that registration group in the portal, you won't be able to claim for agency managed clients against it.
And then the variation that you said, if it's a registration group under core, but you already have registration for core module, does that mean that you still have to go through some type of process with an external auditor?
Sometimes I think it depends on which the registration group is. And obviously, if we're talking about therapeutic supports and things like that, there's APRA registrations, there's qualifications and things that are needed. So I prefer to probably err on the side of caution to not provide any real specifics around that, just because that's probably an NDIS specific question to check in with them. Yeah.
Yeah, no problem at all. Yeah. So if in doubt, ask someone in NDIA commission. Yeah.
Get a consultant, get a consultant.
Or get a good consultant, exactly. So, there's verification and then there's certification. Can you please explain the difference?
Yeah, look, essentially it is like, there are registration groups that sit within the verification module. So let me give you a couple of examples. I'll just make sure I get the right ones because that would be terrible. I think it's household tasks. I think it's and don't quote me on these, but household tasks, home modifications, therapeutic supports. They're a verification module registration group, and there's more. What that means is basically they go through a desktop audit. So an auditor doesn't come out, they do a desktop audit of their documentation. They'll probably phone them, ask them a few questions, and verify the validity of the documentation that they've handed over, etc. And then they only go through a 3-year cycle of an audit. So that's the difference. You move into certification, and so the certification typically includes support work, support coordination, personal care, SIL, all those sorts of things. They all sit in certification. So if you pick registration groups that sit within the certification, you'll be required to undergo a certification audit. So even if you have some verification groups, if you have one certification group, you'll always be automatically assessed against a certification.
And is it, there's a notion online that if you don't have any participants and you're going through the registration process, then you'll most likely get a verification because there's no interviews involved with the participants directly. And then if you are supporting participants, then it will be certification. Is this a myth?
Absolutely, 100% a myth. No. If you do not have any participants and you're going for support work, like those certification type registration groups, you go through as what we would call a provisional audit. What that means is basically be assessed by an auditor on your documentation and your understanding and knowledge of those policies and procedures. Now, what does happen, and it's important to know this, is that and you're still certification. You don't change based on whether you've got clients or not. It's got absolutely nothing to do with it. But what I see a lot of people come to me and they're like, well, you know what? If I go through my audit, then I can have with no clients, and then I get clients. Then I've got 18 months to sort of set up my business and get everything right before they come. Well, that's not how it works. Once you start supporting clients, what NDIS says is you need to have an out of cycle audit. So as soon as they're picking up that you're supporting participants, now you're going to be charged twice for an audit. You may as well just do it in the first place. You know what I mean? Because it's very frustrating for providers to continue to pay for audits when they could have just done it the first time. So no, it doesn't change category between certification and verification. And no, you don't get some free time. As soon as you start claiming for a participant, NDIS is notified and they will tell you have to have an audit within a certain time frame and you need to make sure you get it done. So now you're paying 2 lots of audits.
Well, that's good that we have busted that myth. Thank you for explaining. There's a lot of misunderstandings around registration in the community, so it's good to have that perspective from you. Okay, so what, in your view, in your experience, are there any common pitfalls or blind spots that trip up providers during the preparations and the audits?
I think it really is. If you don't know something, then you're going to walk into an audit thinking that you're all ready to go. And so that is probably the biggest pitfall. So it's about doing your research, understanding what you need to know and making sure you know it before going to audit, if that makes sense. And look, I've seen lots of people write their own policies, which is, I give a lot of kudos to people who go to that effort, but it's very, very, very difficult to write policies that meet the standards if you're not a policy writer. It's just not. I honestly do. I have so much admiration for people who start up after night, right? Because I've done I do it for a living, so I know how hard it can be. But the chances of you actually meeting standards are kind of pretty slim picking. So really, it is about and I feel like I'm doing a sale. I'm actually not doing a sale, but you just get some about with qualifications and get your advice and get the support to know what you need to know to be able to get to audit.
That's right. I agree. It's quite a dry process, right? I've dealt with operations and health sector prior to going into the disability. So that's why I do have that background of writing. And I actually am that kind of person who enjoys reading into documents and operations and just, like figuring out, okay, so I've mentioned this, therefore this document also needs to reference that and, all of that. But rarely everyone enjoys that. I can't imagine everyone enjoying that because especially it is also time consuming. So
yeah, and I think it's important to understand as well, the standards are a set of rules. If you're writing policies and procedures, it's not just policies and procedures, it's the forms, it's all the systems and all the plans that sit around that. But a system is designed around an interpretation of the standards, right? So I think that I read this standard and I go, yep, I reckon my clients could meet this through this process, but it's usually linked to a policy, a procedure, a form, and also maybe a register or something. It's very difficult work. And I think that, sometimes I have people that say to me, well, can I just get your forms? No, you can't get the forms because the policies talk about the forms and a system. They're not standalone kind of things. They're all tied in together as one system as a whole that meets the practice standards that's required they all link. So yeah, I think that's an important point.
Yeah, okay. So I guess by asking templates, you're kind of setting yourself up in your business to just being very average. Is that kind of what you're saying?
I am, because it's not linking in with other stuff. It's not going to make sense a lot of the time without the other stuff connected to it. Yeah.
And I guess it doesn't really safeguard the provider either, because if something happens, they don't know the procedure, policy, what to do, that could actually set them up for real repercussions in case they get audited or investigated in.
Or risk to clients. That's the thing too, the risk to clients. If you don't have the forms, I know that everyone hates them. Like, that's no secret. There's a lot of forms, but the forms are the Bible about each individual person that comes into your service. And so any support worker that is working with a participant should be familiar with every single answer to every question on those forms before walking in to support a person. So, if those forms aren't, first of all, developed properly, we've got a problem. If they're not filled out properly, we have now got another problem. If they're not read, well, we have another problem. And this is where these incidents occur that put participants at high risk. And we can sit there and complain about all the forms, but at the end of the day, that's why we're here. It's around providing safety and support. And also, making sure that, I see a lot of support workers. I see a lot of support workers babysitting participants. That's not what they're there for. They're there to be working with participants towards goals. But if they're not actually understanding or seeing or hearing about those goals, they've got no idea that's what they're meant to be doing. So, I probably just went way off track with your question, but the forms are important. Yeah.
Thank you for that. No, that's all right. So earlier on, you touched on, the registration system not fully covering some areas. And my next question is exactly about that, where registration only covers certain parts. And in your opinion, do you think the current registration system does enough to ensure that the frontline staff, especially support workers, are properly trained and clinically informed of all of those things?
Yeah, look, at the end of the day, auditing is essential. If you wanted to pay for an auditor to go through every single file, look at every single document, they'd be there for months on end. So it is a sampling process. But through a sampling process, there are trends identified. There's also what we call triangulation, which is you're looking at documents, but you're also talking to staff, you're talking to participants, and you're putting a picture together around things. But at the end of the day, it is a sampling process. So it's about the sampling process is very robustly selecting participants that, if we know that the service is providing diabetes support, then we're going to make sure the sample includes a person with diabetes, so we can see they've got a diabetes plan, it's current. The staff that work with that participant over the period of the last 6 months have actually had diabetes training. The sampling process is exactly that, a sampling process. And unfortunately, there are things I'm sure that get through that don't get picked up, but I can't really, I think it's quite a robust process, but obviously, yeah, it is what it is. Yeah.
Yeah, of course. I guess it is also important, apart from being registered and meeting all those standards, you also kind of have to go a little bit further to make sure that your workers are trained and know what kind of supports they need to have, I guess, to deliver. And when you have clients that have these types of disabilities or, diabetes, SORS, things like that.
100%. Look, I can't imagine as a provider that I'd be willing to take the risk to run, if we call it, say, for example, a business. If you're a business owner, who would take on the risk of having people out there representing their business and supporting people with disability who have often got complex clinical and medical conditions without giving them the appropriate training? To me, that is just absolute craziness from a risk perspective as a business owner, let alone the impact to the participant and often the support worker. I often feel quite sorry for support workers where things happen, but they were never told. It was never documented in the risk assessment. They had no idea, and all of a sudden they're finding themselves in a situation. And there's no requirement that they have to have a Cert 3 in disability or personal care or anything. You can come out of a cafe basically and be a disability support worker, and all of a sudden you're dealing with complex clinical conditions. So I just think if we're in the industry, to provide care to people with disability, then we need to be responsible. We need to have an ethical and responsible approach to it, and that is about making sure the people that are working for us have the appropriate training to keep the people that we're serving safe. Yeah.
Absolutely. Yeah, absolutely agree with you. That's the kind of system that we are in, unfortunately. And all we can do is really make sure that, as you said, the people, the workers, the frontline workers that go and represent your company and support participants are well trained, and they know what they're walking in on, when they go and support that participant. Absolutely.
Yes.
Yeah. So I guess my next question brings me to the use of AI. It has become quite dominant in all of the industries, and it's no secret that a lot of providers would start using that. So do you think that this tool is useful, and do you think it should be regulated in any way? What are your opinions on this?
Well, I think I've gone most people through that whole process of not accepting it and disagreeing with it massively and having very strong opinions against it, to the point of, well, you know what, you can sit here and stamp your feet as much as you like, it's here and it's being used. And so having some regulation around it would be great. I think it's very much like the whole question about policies and procedures that are cut and paste, kind of you can have it written down, but if you don't understand it and you can't speak to it and you can't do what you're saying you're going to do because it's been written by a machine, then it's no good to you whatsoever, basically. So that's the bottom line of that. I am concerned. I guess what I'm seeing a little bit around the traps is that support workers are using it for progress notes, and that is a bit of a concern because firstly, sometimes non-English speaking background people will use it because it helps them to articulate better what they want to write down about their shift. And you can't blame a person for wanting to do that. That makes perfect sense, that if you've got tools to help you articulate what you need to say. But the problem with that is the integrity checking of the data. So is what AI has written actually a reflection of what you're trying to say? And I think that's where I want to sort of say, at times I think laziness comes in, because it's oh yeah, I'll just put that now, yep, cut and paste, yeah, I can move on. Or busyness, maybe business is the word, but it can create very big problems. I have seen progress note that actually a participant was shivering because they were cold. The progress note actually said it was a seizure. Now, there's a very different thing between shivering, between being cold and having a seizure. And, there's a big problem with that because, obviously someone's picked up that there was a seizure, and then, oh, hang on, we don't have a seizure management plan. I didn't even know he was prone to seizures. We need to do an incident report to the NDIS Commission. What happens now with this seizure when it was someone shivering? So you can see the repercussions of something like that just blowing out proportion, and also can lend yourself to be, I guess if you have an investigation around your incidents and you can't talk about your staff, it's a bit of a problem. So yeah, look, I don't know. I would love to see it regulated. I'd love to see it regulated, but is that possible, or has it run away? Has the horse bolted? I don't know. Good question. I do not know the answer to. But I'd like
that's a very fair point. I guess it is quite useful for people who have second language, and English is not their first language, to use that tool, as you say, to assist them with noting down. But also there's another issue with data sharing, because you don't know these types of centers, that the engines, whatever. I'm not very technical, but in my understanding, this data gets sent across overseas. So this data that you put in doesn't actually stay in Australia. Someone else owns it, and if by chance someone puts in names, addresses, any type of identification, you don't know how that data is going to be used. So I definitely agree with you. There should be some regulation, and people should be a little bit careful with what they put in there.
The more and more they put in, I think it makes it just actually smarter. Do you know what I mean? The more information, the more people use it, the smarter it gets. Like, I just don't know where this is going to land.
I think it's definitely something that's going to continue growing. And I'm just for using it responsibly, making sure that you don't provide any identifying points, things like that. Just anonymity is the best thing, I think, when it comes to using that. But yeah, in any case, thank you for your opinion. But I also just wanted to quickly touch on the legislation changes that happened in October 2024, just last year. And have you seen any shifts in how easy or difficult it is for providers to gain registration?
No. The answer is no. There's no changes to the auditing process. Like, the practice standards are still the practice standards. Maybe auditors would disagree with me perhaps, but I don't believe that there's really any changes to the auditing process as such. So I don't think that it would be any kind of sort of like a real challenge around kind of actually like increased challenges or anything around actually passing an audit. Yeah, absolutely. Look, I think the thing is like everything's evolved. Like, I've seen so many changes all the time. Things are changing over the last 6 years, and I think even at the very beginning, I think it took a long time for the commission, auditors, providers, everyone to even really understand in practice what those standards actually look like in terms of a system. What was a nonconformity? What isn't a nonconformity? And I think that everyone is slowly coming onto the same kind of like platform around their understanding of what those practice standards mean. And I think at the end of the day, and I guess I can't sort of speak for all the auditors, but I guess it's about the risk. It's a risk to the participant. And that is what is always at the forefront of everything, is that like those risks are managed around the participants, then, everything else should sort of way kind of slot into place or not be as a bigger issue. So it is tricky staying on top of all the changes, but I don't think from terms of the registration process it's changed much at this point. Yeah, that would be my personal view. Yeah.
Okay, yeah, beautiful. And I guess, it's great to hear that there has not been any more challenges since the legislation, but that definitely created more difficulty for the providers in terms of just keeping up with the industry. And my next question is, have you noticed maybe that more providers are choosing to exit or deregister from the NDIA system?
Still lots of inquiries to get registered. So I think that people don't necessarily always do their homework. And I think there's a lot of established providers that, when I was saying before about how the systems have grown and everyone's shared understanding, I think everyone's, including providers, have grown with that. But what people don't understand is that, the governance stuff that I've been talking about with risk management, quality management, just all that strategic planning, operational oversight, that costs money as well. And that is unfunded as well. And I think that like a lot of the time people will go, I'm going to start an NDIS service because I want to work with people with disability, and there's lots of money. Like, I think there's like a really big misconception out there that there's a lot of kind of overheads. So I think once they start to realize, the SHADS increases, wage increases, and the NDIS price guide and things, I think people start to go, hang on a second, wait, it's a lot. And it's not all just money in your pocket. Like, there's a lot of work to be done. Yeah.
Absolutely agree. Especially the rising costs have been quite big this year, sorry, the last couple of years actually, and the fact that the rates, the hourly rates are not indexed, that definitely makes things much more difficult for providers. And I guess my last question, thank you for talking with me today. We had such a long conversation, but it was a really good one. And I guess in a perfect world, you'll be able to change anything. And my question to you is, if you could change one aspect of NDIS, what would it be and why?
That's a really good question. Look, obviously just my personal view, but I know, and we did touch on it earlier, but I just think everyone needs to be registered and be regulated. And, whether there's different ways of doing that, that's, I don't want to say less stringent, because I mean, at the end of the day, that's why they're there, stringent sort of like processes to keep everyone safe. But I just don't think that, don't really agree with unregistered providers operating out there. It's my personal view. So yeah, I guess that's what I would change if I could.
Yeah, that's a really good answer. And I mean, I agree with that. I think the system definitely should change in the future. And I think we are already starting to see those changes, like they are deliberating whether to mandate support coordination, which is good. And hopefully we just keep seeing that those changes coming into effect.
Yes, I hope so too. I think, it's just, we're working with vulnerable people with very complex kind of health conditions, and it's just so risky. So yeah, anyway, that I could probably go for days about that, so I'll let that one go.
Well, I can tell you're very passionate about this industry. So, this industry needs a lot of people like you, so much experience and passion for supporting people and doing it in the right way. That's been really great speaking with you. Thank you so much for talking with me today.
Yeah, thank you for sitting there and listening to all my passion about this particular subject. I'm sure it's hopefully I've stayed on track for you, but it's been a real pleasure for me as well. So thank you so much, and hopefully we will talk again sometime soon.
Thank you.